Migraine is a special type of headache. There are various types of headaches, and migraine is only one among them. It has its own characteristic signs and symptoms and special features. The main symptoms are nausea, sometimes vomiting tendency, then intolerance to light and sounds, and these are seem to be very common. But the intensity varies from person to person and from age to age. And side by side, there are so many associated symptoms. There may be most often the headache is focused or located on a special area of the head. Most often it is either side of the forehead, temple region, or any other side on the head or parietal region, and rarely it will be all over. And in severe cases, the pain will be radiating to other areas, to ear or to the back of the head, or sometimes to the neck region, or sometimes shoulder, or even to the eye. And sometimes it will be affecting the teeth also. There will be toothache. Like that, the symptom varies. And in many cases, it is seen that there is a pattern to this headache. It occurs once in a month in some cases. Sometimes they will say twice in a month, or once in a week, like that. The symptoms comes. But there are trigger factors which increases the intensity. The trigger factors also varies from person to person. In the case of women, most often hormone changes are a factor. During menstruation period or just before that, the trigger, migraine will trigger. Or some food items. Some people will be having this triggering with the spicy foods. Sometimes some aerated like drinks. Like that it varies. There are people who are having triggering factors being the pungent smell. Even the smell from the kitchen will trigger the factor. Like that it is a unpredictable condition. That is why it is known as the cause is still unknown. Various hypotheses are there, but actual cause is still unknown because the symptoms are varying and the symptoms also are varying. And these two symptoms, especially in sensitivity to light and sound, is the most common thing. I have seen ladies who are scolding their children because they are making noise like that. They will be shutting the door and keeping inside the room like that. So usually what happens, people will be taking one painkiller and keep quiet and calm in a room. And after sometimes they will be having a tendency to vomit, and after vomiting it will subside. Like that the symptoms also changes. So what happens, as the time passes, the intensity may increase in many people, or according to the trigger factor, the condition may be more severe. Excessive severe dizziness and pain in the head will be intolerable. Like that it changes. That is why people are searching for treatment for that. The ocular symptoms also, the people will be scared of the ocular symptoms. There will be temporary blurring, or sometimes scotomas like, or for a second there will be blackout. Like that also it is very severe symptoms are there. So people will be afraid of it and will be searching for a permanent cure or a permanent solution for this. Now coming to Ayurvedic aspect, any type of pain is related to Vata. We know there are three elements or functioning factors in Ayurvedic theory, that is Vata, Pitta and Kapha. Here Vata comes the functioning factor or the activating factor, but in the case of head region, there is a stationary, or in Ayurveda we will say sthanic dosha. That is that some doshas having its own seats in that particular area. Like that, kabha comes to the picture. So Vata is making the disturbance or making the problem in the site of or in the seat of kabha. This is the actual situation. So we have to maintain Vata or subside the visheshan of make the Vata Shamana. The term is Shamana in Ayurveda, and without disturbing the sthanic dosha, that is Kabha. This is the actual treatment protocol in Ayurveda. So that is not a simple thing. Actually, these two are having some opposite properties or functions its own. Both are having Shida or cold, being cold as the common feature, but all other things are almost opposite. So the treatment should be very careful. Otherwise, what will happen? As usual, it will be getting subsided by some medicine, and it will trigger again. It will come again in its own way. So a permanent cure is very, very difficult from the treatment side. So according to theory or Ayurvedic principles, the maintenance of the Kabha is very important. For that, this Nasya means very scientific method of nasal drops, applying medicines through the nostrils. That is very important. But it cannot be done all on a sudden. There is some previous steps before doing Nasya. We had to take some medicated ghee and then ferment, then apply some oil on head and then massage. Like that, there are some previous steps. We will say Purva Karma. The term in Ayurveda used is Purva Karma. Only after that Nasya can be used. And the medicine should be having two very particular properties. I have already told that the Vata and Kabha are equally important. When we treat only for Vata, Kabha will be increasing, vitiating. And when we consider Kabha only, Vata will be vitiated. So to maintain these two should be the basic treatment line. For that, very few medicines are there to control the vitiation of both these things. The selection of this medicine is very important, because the range of people, that also very, very wide. Even from teenagers, it will start. 14, 15 years of girls or boys are having this problem. It may persist up to the ladies up to menopause or up to 50 years, like that. So the range of the victims are very, very wide. So itself, selection of medicine and the treatment line also will be varying from. We cannot say this is the treatment of migraine. We can't say, because we can only say this is the treatment for migraine of this particular person or particular lady. Because the intensity of the migraine also varies from ladies to gents. That also is seen. I think the victims are more ladies, because hormone changes are very common or very high in level in the case of women. So most often the clients or the patients will be women only. So we have to consider that hormone changes also in their case. And when we touch the hormone chain, we have to consider other hormones also, mainly thyroid hormones and also pancreatic insulin. This also takes a role. So considering all these things, we have to select some oral medications. Simply doing Nasya, it will not get subsided. So we have to select some appropriate oral medications also. And it should not be for a particular period or for that particular time of trigger. Because the pain will be for some time. In some cases, it will be subsiding only with a single painkiller by one day or sometimes by 12 hours like that, but it is again coming. And it is touching their profession or making some nuisance or disturbances in their daily life. That is why treatment becomes necessary. So oral medicine should be continued. In Ayurveda, the treatment is not for that particular time of onset. It is to maintain the condition or situation in such a way that it will not trigger again, it will not come again. For that, the internal medicine should be taken for a long period, minimum 3 months or 6 months, like that it is to be taken. For that, once the kapha is already subsided or it is already under control, then we have to consider vata, not to activate or to this vata again as a causative factor. For that, medicated ghee has a very important role. And here we have to think that the vata of the head region is the particular fraction of vata, that is pranavayu. And the vata which is coming into role in the case of vomiting or nausea, etc., that is another fraction of vata, that is vyanavayu. So we have to consider these two fractions while while coming to the treatment line. So this is the main basis for the treatment of migraine. So even after subsiding or controlling the migraine, we have to take some factors as a preventive measures, or to have some restrictions in their food items and also in their habitual factors. That should be to maintain the vata mainly, to be calm in nature or to avoid the trigger factors are the main things. Just like yoga and meditation, etc., has very great influence for controlling migraine. And to have the good head oil before this head bath, just like a head massage, that also has seemed to be very useful. And to avoid these trigger factors such as spicy foods or that type of masalas, that also should be avoided for that particular person. So taking some measures to control vata by these food items and habitual factors, that patient can be safe from the attack of migraine. If the intensity of the migraine is very severe, the simple oral medications or home remedies like may not give the desirable results. In such a case, the basic or scientific methods for the control of vata should be taken. For that, there are highly effective treatment procedures such as Shirodhara, Shirovasti, etc. And these procedures are to be done under physical rest and under the control or monitoring supervision of an experienced hand, by under the monitoring of a doctor only. Among the trigger factors, nowadays the professional stress also is a very serious factor, because everybody is under stress, either professional or personal. And in the group of youths, this professional stress is very important nowadays. They will be simply, they will say there is stress. We have made a questionnaire to rule out these things, but in all the cases, one factor will be stress. So it is to be considered. But simple oral medicine will not give such a, it will be going to sedatives. That is not a treatment. We had to make the nervous system or the hormone system strong enough to shoulder this stress. That should be the line of treatment according to my experience. Otherwise, we cannot, we can't say that don't go to stress, don't go to tension. Like, it is not possible nowadays, practically not possible. They all are having ambitions and having that much high thoughts. So stress will be there. So the system should be maintained in such a way so that they can take over the stress. For that also there are methods in Ayurveda, so many methods. There is Shirolebanam, in Malayalam we will say Talapodichil and Talam, that is putting very special types of medicines on the head, in the central region of the head. These are highly effective. That is, that can be done in an IP level only. In severe cases, I have already told that there will be a location or focusing points, and then it will be radiating the neighboring structures. That is very, very common, mainly to the eye, to the ear, or to shoulder, that I have already told. But in some cases, this will be very severe, and they will be complaining side by side these symptoms also. There is headache, there is earache, and there is throat pain, there is this nasal, sometimes even unable to smell. Dyspnea, that also may happen. So in such conditions, what happens? A special treatment for that structures also will be needed. In the same way, there is hormonal changes. And the hormone changes also have a role in the onset of this migraine. So if that is the trigger factor, there will be so many other symptoms. It is unpredictable. Maybe intestinal problems, sometimes chest pain, or unable to, sometimes sleeplessness, or like that it varies. The symptom changes from person to person and their body constitution or their other physical features also. So not only vomiting, not only dyspnea, not only light intolerance, they will be having this type of severe symptoms in that condition, in that particular period. So there is necessity of treatment procedures to subside the symptoms of that particular organs only also, because the symptoms are coming to that organ only because there is some weakness to that structures. Why a person is, migraine patient is having symptoms on the eye means his eye is more sensitive or delicate. That is why symptoms are catching them. And why another person is having the symptoms on the ear, that means there is some delicacy or some predisposing causes in that organ. Otherwise, it will not touch there. So, in such cases, we have to consider the nature or the strength of that particular organ also. And some treatment methods are necessary to protect that organ. That also comes under the treatment protocol.